Good afternoon, everyone, and welcome to today's live town hall, the state of women's health. I'm Kelly Wallace with iVillage, thrilled to be here once again with Secretary Sebelius of Health and Human Services. This event is for you. It will be live streamed on iVillage.com and also HealthCare.gov/live. Throughout the next half hour, we'll be taking your questions, and you can send them to us live on Twitter at iVillage, hashtag HHS Chat. Madam Secretary, thank you once again for talking with us.
Well, Kelly, it's great to have you here. And Happy New Year.
Happy
we haven't
New Year.
seen each other since the 2012 began.
Exactly. And forgive me, I have to wear glasses during
Not a problem.
to read some
I
of these
brought my
questions.
glasses here too.
We have so many questions. So first off, regarding the provision that most employers will now be required to provide free contraception as part of the health care law. One of our iVillage community members asking, will the so-called morning after pill be covered in that?
Well, all of the FDA recommended contraception is included in the notion that women should have access to contraception. Kelly, this is a drug that is taken by women more frequently between the ages of 14 and 40 than any other kind of medicine. We know from the scientists that contraception is incredibly important for women's health and for families' health, for children's health, and it often is a financial issue for a lot of women who can pay up to $50 a month out of pocket for accessing a doctor's prescription. So this really was the Institute of Medicine's recommendation that as they looked at women's preventive services, as they looked at what often is missing in insurance plans, domestic violence screening, various kinds of mental health benefits, help with nursing mothers, and contraceptive services will be included as an essential benefit in health plans.
And the community member asking, and the so-called morning after pill covered as well?
Plan B will be covered as one of the options that women would have.
You know, of course, a number of people in our audience talking about what happened just back in December, right? How the FDA ruled that it should be okay to receive the morning after pill over the counter for all ages. You did something unprecedented, right? You kind of vetoed that move. Some people were saying, you know, why'd you do it if the science is one way, and was it politically motivated? One of our community members is asking.
Well, I don't think there's any question that the so-called Plan B one-step is safe and effective. That's one of the standards, and the FDA has signed off on that. And it's been available to women throughout this country and in Europe for years. The issue really is over-the-counter then meets a second set of standards. Is the language able to be comprehended by all ages at all points, and is their actual use match up with label comprehension? Because you don't have any healthcare provider, not a pharmacist, not a doctor involved. And I really felt that the data presented as part of the over-the-counter application really did not include the full range of girls for whom the over-the-counter access would be available, and that's really why I made the decision. My only choice was a straight up or straight down. People said, well, why didn't you modify it? Why didn't you just pick a different age? That really is not within our jurisdiction. It was either approve entirely what the company had asked for, which was all ages, all shelves, all stores, or deny it. And I'm hoping that we can, revisit this issue. It doesn't change the availability of Plan B right now, which is on the shelf, over the counter for women 17 and older, and with a prescription for women 17 and under. That did not change at all by this application.
And one question that came in while you were talking regarding contraception, coverage of condoms too? Or no, that's out-of-pocket costs for the individual consumer?
You know, I think that condoms will be covered by this if somebody chose to use their insurance coverage to actually get a condom, because that is clearly in the range of the FDA-approved, contraceptive issues. There has been a lot of misinformation is part of the reaction to the rule decision, that the statement I've seen several times that abortifacients, drugs that actually cause some kind of spontaneous abortion, would indeed be covered, and that is just not accurate. Those are not regarded as contraception and would not be covered by this.
These are questions that come in, and you hear these stories all the time. This came to us on Facebook. I am a 58-year-old female unable to work because of severe migraine headaches and severe depression. I have no insurance, so I can't go to the doctor. What do you suggest I do so I can get medical attention and be able to afford the medicines I need?
Well, one of the pieces of very good news, Kelly, about the Affordable Care Act, the law that President Obama signed in March of 2010, is that we are beginning to change the situation for the kind of women who are out there either totally uninsured or miserably underinsured, where they have some coverage, but it doesn't cover their needs. And it's really part of, I think, what the president was talking about the other night in the State of the Union when he talked about a set of American values where everybody gets a fair shake. Your health care shouldn't be determined by who your employer is or where you live in the country or which insurance company decides to pick and choose you in or out. And those days are coming to an end. Right now, your questioner has some limited choices. She may qualify for the pre-existing pool in her state if she has been denied health coverage because she has a pre-existing condition and no insurer will take her. Every state in the country now has an existing pre-existing condition pool that she may be applicable for. If she indeed doesn't work and doesn't have the money to buy insurance, she may well qualify for a Medicaid program, again, in her state, and that is available. And by 2014, we'll have a new market in every state where people will have an opportunity to get some financial help from the federal government if they're below an income level, and shop for insurance without any pre-existing condition limitations being put on anybody. A big step forward for women who often are in the market without insurance or very underinsured and paying 50% more on average in an individual market for policies that deliver exactly the same benefits as their male colleagues have.
Absolutely, and I want to encourage everyone again, bring us your live questions. You can tweet them to us at iVillage, hashtag HHS Chat. And Madam Secretary, following up on that, one of our iVillage community members pointed out that according to the National Law Center, in 2010, you know these numbers, nearly 20% of American women, 1 in 5, lacked health insurance. The numbers are even worse in New Mexico. Are there numbers, is there anything you can point to that the Affordable Care Act has done to change those numbers and increase the number of women who are insured and not underinsured, as you pointed out as well?
Well, what we know is that 2.5 million young adults, many of them women, are now able to be insured on their parents' health insurance policy. That is 2.5 million additional young Americans since the health bill was passed. We know that a lot of moms are breathing a sigh of relief, and I met one of them yesterday. I met Robin in Baltimore, who is the mom of a child who was born with a heart defect. And Jax is one of twins. He had the defect, his brother didn't. They've already spent a lot of money, but her son will not be locked out of the insurance market because that has gone into effect. So there's some young children, women, who now are getting insurance. The bulk of the adult, there certainly are women who now are participating in the high-risk pools, the pre-existing condition pools. And I met Gail out of New Hampshire, who is in the midst of a chemotherapy treatment that she wouldn't have had access to if the Affordable Care Law hadn't passed. So there are pockets of women, young women, children, older women who now have insurance. And again, by 2014, 2 years from now, women will be able to come fully into the market as adults without pre-existing health conditions and with some financial help to get insurance.
Just had a question come in, so interesting. Is there anything under the health care law or anything your agency is doing to help when it comes to patient advocacy and patient navigation? I mean, we all know, right, what a minefield it can be. I'm sure the women you met in Baltimore yesterday gave you an earful, right, about doctors and medical bills. Is there something under the law or something you're considering to assist people in that effort, in that way?
Well, right now there are consumer assistance programs in states around the country who are helping women and men navigate what is often a very cumbersome, complex market. As you know, Kelly, and you referenced it early on, we have a new website that is much more transparent about not only the insurance market, but about some of the benefits in the law, when they go into effect, what kinds of questions to ask. The website, HealthCare.gov, is also full of good information about medical conditions, questions to ask, ideas to have. And I think that as part of the new insurance exchanges, there will be a huge consumer outreach to help people get into the insurance marketplace. On the healthcare side of the puzzle, when you come in contact with doctors and hospitals, I think that one of the changes that we've seen is a much more focused effort on patient-centered care, bringing services to the patient, answering questions. We're going to be rewarding doctors who coordinate care. So it isn't any longer up to you, if you see 3 or 4 different doctors for your diabetes, to figure out what's going on, but they will get an incentive and be expected to coordinate care with one another. The introduction of electronic health records lets your primary care doctor, for the first time, coordinate that care. So if you're going to see somebody about your circulation and then see a heart specialist and then have somebody else deal with you, that information will be available and ready to deliver to you. Right now, we have patients are out on their own too often. They are confused. They're
the ones required to do, as you said, all the legwork, and some people have more resources than others to do that.
You bet. And those days really are coming to an end. There will be a very specific emphasis through the Affordable Care Act and an expectation that when you're released from the hospital, you're not on your own. Somebody actually monitors your follow-up care, and their payment will depend on making sure that you transition well. We will be providing incentives for medical home teams to make sure that patients can avoid a hospital stay in the first place, that primary care docs, again, get to coordinate care. So talking to one another is one of the things that the best medical systems in the country do. We want all medical systems in the country to begin to do just that.
And as a follow-up, a question just came in about, what about the mental health patients who can't advocate for themselves? What happens to them?
Well, there are a couple of pieces. First of all, the law has changed. So mental health benefits are now part of all health benefits. It's not a standalone coverage. It's the so-called parity law, that you should have mental health issues covered the same way as physical health issues. So that is a legal framework that we're working under now that wasn't the case in the past. And again, I think it will be up to patients to, up to the physicians and mental health technicians and psychologists to coordinate care on behalf of their patients. That, again, is going to be a payment expectation. It's not just that you get paid for seeing somebody, but you get, really, your pay will depend on outcomes and on delivering a kind of service to that patient that actually leads them to better health in the long run.
You know, we have a lot of working moms in our audience. You're a working mom, right? Your kids are older now, but so one of our iVillage community members wanted to know, as a busy working mom, what is your best tip to keep children healthy? What would you say is the #1 thing busy working moms can do to keep their kids healthy?
Well, sleep is good.
Yeah, exactly.
I think for kids
and for moms to do, probably
but
too.
Certainly
yes.
Sleep is good, and I think sleep, eat, exercise are probably the 3 areas, and moms can really not only help keep themselves healthy by doing some of all of the above, eating healthier meals, playing with your kids, but getting them to bed on time, getting then yourself to bed on time, and getting some exercise. Again, it can all be around family time, taking walks together, go play in the park together, go outside and shoot some hoops with your kids, even if you can't make it into the basket. They'd be thrilled to beat you a time or two.
Oh, yes.
But that kind of activity, I think, keeps everybody healthier, keeps families together, and I think is there's always time to do a little of that, and I think it actually keeps kids healthier in the long run.
Definitely. Someone else asked, what do you believe is the most pressing health issue facing our country, particularly women? What would you say?
Well, I do think the biggest sort of silent crisis that we have is the issue around, I mean, there are two issues, obesity and smoking. We know that those are the two major underlying causes of a lot of the chronic conditions. And so having parents, if they still smoke, stop, get some smoking cessation help, keep secondhand smoke away from your kids, do anything you can to keep your kids from smoking in the first place. That's a huge move toward your health and certainly toward their health. But also obesity, which really isn't about how good you look or what clothes size you have. It is about the condition of your heart and preventing diabetes. What we found, Kelly, recently is that if you are pre-diabetic, losing a little weight, and I don't mean 50 pounds, 100 pounds, I mean 10, 15 pounds, and getting a little exercise, taking a 30-minute walk 4 or 5 times a week, you are 65% less likely to become a diabetic than if you don't do those two things. So there's some very simple strategies that eating a little healthier, getting a little more exercise, and not just for you, but for your kids, that can make a huge difference in a lifetime of health.
Absolutely. I want to encourage everyone once again to send us your questions live. You can tweet them to us at iVillage, hashtag HHS Chat. Madam Secretary, we have our iVoices, our Real Mom contributors to iVillage, and one of them wrote in about how they're all following this courageous battle of a mom who blogs, and she is on Twitter at WhyMommy. She's battling inflammatory breast cancer and is currently in hospice, and it's just a heartbreaking story. But she said she wanted to know, what message would you want to give other women about what else they can do beyond mammograms to try and keep them safe? And is there anything they can be doing to try and keep their kids cancer-free without coming off as like some alarmist here? But is there a message we can be sending our kids and more we can be doing as women ourselves?
Well, I'm not sure. It would be wonderful if there was some, way to keep your child cancer-free. Again, I was with this wonderful young mother yesterday in Baltimore who, totally healthy 2-year-old, took her to a checkup in October, and she has been diagnosed with childhood leukemia, a very curable disease, but she has a number of years of very scary treatment ahead of her, out of the blue, totally healthy. So unfortunately, there's no simple methodology. I do think paying attention to the air we breathe is important, and demanding as moms and as citizens that we have clean air, that we have clean water, paying attention to, the kinds of chemicals that are out and about. There's a lot going on these days of sort of bashing the Environmental Protection Agency for its overreach. But our health and our children's health is affected every day by what kinds of conditions are out and about. That you can't stop your child from breathing, but you can demand in this country that we have clean air and that we have clean water. So those are tactics that work. I think getting regular checkups, but again, doctors have a belief that, there certainly are some genetics that lead one to be more cancer prone. But the healthier lifestyle that you can live, the more you keep yourself in good health, and the more you get routine checkups. So if indeed something is diagnosed, you find it as early as possible and treat it as early as possible. My aunt died at 33 of breast cancer. She left behind 5 children, my cousins. It was the first experience that I had dealing with a death. I was 12 years old, and I remember my mother's friends, a breast cancer diagnosis was a life sentence. They were dead within a number of years. Those statistics look very different today, particularly if you detect it early. Early detection means a lifetime in remission often. Late detection means a death sentence still. So taking advantage of routine checkups, self-exams, making sure that we are aware of changes in our own bodies, I think is a way. You may not prevent a cancer situation from occurring, but you sure can be a lot more aggressive in identifying it, rooting it out, and taking advantage of the technology and medicines that are now available.
All right, Madam Secretary, we're running out of time. Of course, this goes by so fast. I could talk to you all day. One more question from the viewers out there. How will you put a cap on health care premiums for families?
Well, again, I think the good news is that medical costs are beginning to slow down. They're still increasing, but at a much slower pace. What we can do and what we are doing is demanding that insurance companies live by the so-called 80-20 rule. 80 cents of every health premium dollar has to be spent on health benefits, not on overhead or CEO salaries. And in fact, Kelly, in 2012, a lot of consumers are going to get checks back from their insurance companies because they didn't meet that. That slows down the cost. We also have oversight over rate increases that we are able to, indicate if they are justified or unjustified and call on the insurance commissioner to lower them. We know that in terms of family output, the question that we just talked about breast cancer and cancer screenings, insurance policies right now, thanks to the Affordable Care Act, are worth far more. Preventive care is covered without copays or coinsurance. We think it's important to encourage people to take care of their health before they might get into a situation which causes illness. We think it's important for women to have access to contraception without copays or coinsurance. So those kinds of preventive care that are so important to women's health will now be actually free of charge to encourage people to take advantage of them. So there are a variety of ways that out-of-pocket costs are going to go down.
Very quickly, my audience definitely wants to know, will you be working in any way in the re-election campaign?
Absolutely.
All right. And what will you be doing?
Well, I'm likely to be out around the country talking to women and talking about some of the health benefits that are available and why it's so important that we keep moving forward on this law.
And very finally, because people were asking, you're a former governor. You're a governor of Kansas. A lot has been made of the photograph between Governor Brewer of Arizona and the president, where she was pointing at him. You're a former governor. Do you think it's appropriate or inappropriate for a governor to be pointing at a president, regardless if the president is of your party or not?
Well, I think it's more appropriate to maybe shake his hand and say hello and greet him warmly when he comes into your state. I was able to do that a number of times with President Bush when he visited Kansas, and I was able to greet him. So I don't necessarily think a finger wagging is the most appropriate exchange for anyone to have with anyone else. I mean, welcome into your state. If there's a difference of opinions, let's talk about it.
All right, Madam Secretary, thank you so much for taking time. We
Great
really
to visit with
appreciate
you.
it. And thanks to all of you for joining us. Again, this was a forum, a live town hall for you on the state of women's health. We hope we'll get the opportunity to do these again with Madam Secretary.
Come back anytime.
We'd love that. I'm Kelly Wallace with iVillage. Thanks for joining us.